I'd like to welcome everyone to the quarterly Mississippi State Board of Health meeting. We'd like to begin with an opening prayer. Mr. Moody, would you handle that for us? Everybody would please stand.
Our Heavenly Father, Lord, we thank you for this opportunity to allow us together to the board and as members of the State Board of Health and our employees to discuss things that will make our state better for all our people. We ask that you guide each and every decision that's made to do things that are within your will. We thank you for your love, your mercy, and your grace that you show to us every day that you allow us to live in your world. Thank you most of all for sending your son Jesus to the world that through our belief in him we might have life and have it everlasting. Just give us by me the sin and the shortcoming. In Jesus' name, pray. Amen.
You remain standing for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. First item on the agenda is approval of the minutes from October 9th, 2024. Has the board had time to review those? And if so, is there a motion to approve? There's a motion and there's a second. All in favor say aye. Any opposed? Excellent. Next item on the agenda is our state health officer's report. Dr. Edney, I will turn it over to you.
Great, thank you, Dr. Lampton, and Board of Health members. Thank you for your time and your service, and we're appreciative that we have legislative leadership here today in the public and many fine MSDH employees. It's a good day for public health. They serve. I'm, as your state health officer, we are moving into my third legislative session. I feel like we're in a good place for public health and for the Board of Health an agency agenda. We've been doing a lot of work since last October when y'all set the agenda, and I think we are well positioned to work our way through the session with our partners. Before I give our epidemiology report, I want to make two important sets of recognition, if I may. What I'd like to do is to highlight areas of the agency's work where I have seen superlative service with each quarter. And I'm very proud of both of the teams that I have with us today. Liz Harrington, if you would stand, I want to first recognize food protection and how grateful I am as a citizen of Mississippi, for y'all's great work. We had an incident that occurred, Mr. Berry, on a Saturday that was very important, needed to be tended to immediately. And despite it being, a Saturday afternoon, the food protection team mobilized and took care of it. And it was, and that's just not one episode. I'm just so proud of the hard work that they do and working with our epidemiology team. And we'll recognize that another time, that the partnership between different programs in the agency works so well to protect the citizens of Mississippi. And so this is leadership of the folks that make sure that when we're going out to eat, having catered meals, that we don't have to worry about it being safe because they worry about it being safe. So Liz, if you would, introduce our team.
Dr. Edney. So the boots on the ground for the incident that Dr. Edney referenced were Ms. Brittany Partridge and Mr. Adam Follett, who are here in front of me. You guys can stand. Brittany serves as the Deputy Director of Environmental Health, but also as a direct report over our food protection program. And Mr. Adam Follett serves as the Director of the Retail Food Protection, which oversees food safety for the over 14,000 retail food facilities in the state of Mississippi, with a staff of about 35 folks. They do an amazing and tremendous job, and we're all blessed to have their service as citizens of the state of Mississippi. Again, these are the folks that if they're not there, they're missed. I'm definitely happy to be in a leadership role, but I'm not nearly as missed by the people of Mississippi if I'm not there. And so again, I want to recognize these folks because they make folks be able to go out to eat and not have to think about it. And when we do our jobs right, nothing happens. And so that's what we take that to heart. And we want folks to be able to enjoy those things that they enjoy without giving it a second thought. And it's because of folks like Ms. Partridge and Mr. Falk.
Thank you. And I think y'all know how much I appreciate y'all's great work and how much we depend on y'all. So thank you and keep it up. If I really went into detail of all the things I've seen them do, the meeting would go long and you would fire me, so I'm not going to do that. But I'm just really proud of that team among so many of our teams. The next recognition is that we've got to recognize our performance improvement team. But really, I'm recognizing the entire agency workforce because I'm very proud to announce that we have achieved full reaccreditation status as an accredited State Department of Health, FAB, Public Health Accreditation Board. This is the objective evidence that we are competent in what we do and more than competent that we excel at what we do. And that is because of this stellar workforce, the leadership that you get to meet that's here today, all their team members. This was an 18-month process to demonstrate that we were maintaining excellence in public health as the Department of Health at the state level. Not every state has this recognition. I'm very proud that we do. And the fact that our hard work does not go unrecognized and that objectively measured evidence is very important to me. So it's not just a reputation based on relationships. This is a professional recognition for our State Department of Health, for which I'm very proud. I'd like for Wayne Jerome, the leader of the team, to come forward, and I'm going to present him the plaque and his team who did all the work. And then, of course, we will place it in a prominent area in the agency. So, Wayne, congratulations and thank you, buddy. I want you.
Happy here hold this flag. Like the members of the team that made this successful. Angie Gainey from MSDH, would you please stand? Kaylee, Robbie, and Matt. This would not have been a success without them, and of course, broader people at MSDH. So thank you.
Thank you. Mr. Chairman, we will quickly move through this section of the report. I do want to give a brief epidemiology report for you and the board and the public. Nationwide, we are seeing increasing rates of pertussis, which is whooping cough. This is one of our vaccine preventable illnesses. It's not just increasing in Mississippi, it's increasing nationwide. Thus far, our epidemiology team has been able to work each case, and we've had one that occurred in daycare. We were able to get our arms around and prophylax all the children that were exposed. We've been able to treat and prophylax several families. We're watching these rates closely. We're not out of line for the rest of the country, but it is one of the areas of concern that I have. West Nile was a difficult year this year. We had now moved out of the mosquito season, but we had a significant increase in West Nile cases and pretty much in line with the rest of the Gulf states. But this is an item that we're having to monitor. Right now, I would say there's not as much investment in mosquito mitigation as we need as we continue to watch these cases next year, that may need to be something that we're asking for intervention in terms of mitigating the mosquito population better than we've been doing. We've had definitely more deaths this year. Respiratory disease season is at full swing. We are seeing a lot of flu, as every bit of it is influenza A. We are seeing a significant amount of RSV in children. We have had a couple of pediatric deaths related to RSV, and we are definitely encouraging that those who are eligible for vaccination and passive immunity to receive that. COVID is starting to tick up again, but the good news is we're not seeing a strain on our hospitals. This time, the last 3 winters, this time of January, we were at significant trouble. And this year, we have plenty of capacity. So that is part of that. The flu season is not quite as bad this year, but also our hospital capacity is improving. Hospital staffing has been improving statewide, and we're able to breathe a little bit better this winter than we have the last 3 winters, and that is great news. We are being very vigilant regarding H5N1, highly pathogenic avian influenza. We have 2 chicken flocks that were infected. State Board of Animal Health is doing an amazing job working with Department of Agriculture, State Veterinarian, Dr. Watson. They've been working very hard to contain that. We did have, Dr. Watson had ordered two different counties, a depopulation of those infected flocks. And about a week ago, we had 7 workers that had been part of that who became symptomatic with flu-like symptoms. But they are using PPE as their depopulation work. And thankfully, all 7 cases turned out either to be regular seasonal flu, H3 flu, or COVID. And we still have had no H5N1 human cases. So we're being vigilant about that. We are cooperating with the State Board of Animal Health in providing PPE support for those workers. We have plenty of PPE on our strategic supply warehouses, and we are mobilizing that to support them, because if we invest in helping to protect them, then we're able to protect the population better. So far, so good. I am personally engaged on the H5N1 front. I would like to recognize, where's Dr. Dotson? All right, Dr. Renee Dotson has agreed to brush off for MPH and to help us in the state epidemiology work. And very grateful that she is taking on this task. I've been serving as a state epi for the last 2 months, working with our epi team. She's going to step in to help me. We still have Dr. Dobbs and Dr. Myers on contract to support us. Miss Teresa Kettle she is with family needs today, but Teresa has been promoted to deputy state epi to support Dr. Dotson. And I have tremendous confidence in the epidemiology team. They have been doing amazing work. They have contained the salmonella outbreak at East Mississippi, put about 20 people in the hospital, did a great job containing that. They were able to, working with food protection in both of these cases, able to work. Incident on the coast of norovirus, made about 30 people sick, and we're able to contain that quickly. So this is a great example of teamwork. So Dr. Dotson, thank you. Any questions?
Any questions for Dr. Edney? I know we're all very pleased he's taking a laser focus on H5N1 and doing our best to prevent that.
Yes, sir. In terms of our appropriation work, we have completed all of our leadership meetings, including the governor and our legislative leadership, and including our first round of appropriations. We'll be testifying in our appropriation budget hearings next week, I believe. And we're prepared for that. We've already had our first round of appropriation meetings that have gone well. They understand our needs and they appreciate that we have a very reasonable ask. I'm very proud for Dr. Dotson's Center for Public Health Transformation. They've been actively working with eligibility determination and enrollment assistance through the open enrollment period for the marketplace exchange insurance plans for the folks that we serve that are uninsured, and leaning into better determining Medicaid eligibility and providing enrollment assistance there. That work is going to become more robust as we're moving forward, and we'll keep you appraised of how that's doing. But I think we're off to a good start. I do want to make sure that the public is aware and that y'all were aware that part of our influenza response is to provide a new test to treat program. So we're not just testing at the county health department, we're testing and treating. But for those who are uninsured, if anybody can come, but we're an access point for testing and treatment for our respiratory illnesses. And if we're identifying influenza, then we actually have stockpile in a public health pharmacy that we can provide treatment for the uninsured for. And we can't do it for COVID. We don't have the resources to stock Paxlovid, but we are able to facilitate getting prescriptions called in for them. So, they're using us for acute care for flu, RSV, and COVID, and just another opportunity to try to be a more robust part of the safety net. The MSED program for opioid use disorder continues to grow. Dr. Pearson's doing a great job with her team, and y'all were approaching 400 patients, 399 patients that are having access to treatment for opioid use disorder all over the state through our county health departments using telehealth support. So these are patients that do not have access otherwise, and they not only are seen for free, but their medications are shipped from the public health pharmacy to them at no cost, and their mental health support, behavioral health support outside is also provided through the grant program. So it's been able to increase access for treatment, especially for opioid use disorder, all over the state. And I had already shared with y'all that in 2023, we saw yet another reduction in opioid deaths. So we're one of the few states that have been able to register reductions at both 2022 and 2023. And so I'm very proud of that work, Dr. Pearson. That this is part of that opioid overdose mitigation work that we're being successful with. I do want to let you know that all of our legislatively mandated reports were completed on time and posted on time and have been hand delivered to the appropriate leaders within state government. And you all have copies of that, including the annual report, which is hot off the press. And as you study that, we can go into the annual report issues more later time. But we are seeing some successes, and of course, we see continued challenges that we continue to work on. I do want to announce to y'all what I consider a huge breakthrough in terms of primary prevention. Dr. Lance Evans, the State Superintendent of Education, and I met with our teams earlier last week, and able to talk together about the true solution of improving our severely poor health outcomes is working with K through 12 on primary prevention, and especially K through 6, to do just not health education, but health promotion. So I'm very sensitive that we're not asking for more work to be added to our teachers. We don't need more classroom. We don't need more classes in health. What we need is just health promotion as part of the school day. And for that to be just moving through K through 12. when I shared with Dr. Evans, the leading causes of death for K through 12 age students, up the eye opening. And so, stage one is we have to reduce that. There's a lot, virtually all of those deaths are preventable. The lion's share of those deaths are preventable. And us working together, I believe we can improve that. And then just raising awareness that we absolutely need to successfully educate our children, as we're doing a better job of. Our children need to be healthier, but we need them to be healthy when they're 38. We need them to be healthy when they're 57. And so if we can help ingrain just basic health promotion principles that are not complicated into their life at a young age, as we have done with smoking cessation, as we have done with seatbelts, as Dr. Edward Hill has begged us to do for a very long time, then I believe that that will probably help move the needle long-term more than anything. So I'm very excited about the partnership between Department of Health and Department of Education. We're not asking for statute. Dr. Evans and I have talked about how to fund it and how it needs to look. And we're going to start by working with school district leadership around the state and helping raise their awareness, and then listening to them about what they think are their strategies. We'll be looking at what works in other states on the health side and on the education side, and then pull together and move forward together to do what looks like will be best for the health of our children and the health of the population.
That's exciting. It's very good.
And the last announcement that I have are two sad announcements. Not sad for them, but sad for me. And first off, Dr. Turner, if you would stand. Dr. Justin Turner came on with me in August of 2022. Been a young physician that's been important in my life. And he agreed to come on as the chief medical officer at the beginning of my tenure, has been passionate in the work of public health, embraced the work of public health very quickly. But he has notified me that for several reasons, all of which I respect, and that he needs to step away from the CMO work. However, I have convinced him to stay on to help me in the ways that I need him to, and to help provide capacity as a public health physician. So he is going to stay part of the family, and I told him it'll be harder than that to get away from us, but I do understand and appreciate that his need to step back from his full-time role and to help us more on a part-time basis. So Justin, I just want to personally say thank you in front of the Board of Health for your service. Thank you, buddy. And Dr. Victor Sutton, where are you? Thank you is not enough. I probably will tear up. Victor helped me early on in ways that I needed, and has been a great source of advice for me, and has stood firm with me through some pretty difficult times. And he was willing not to retire 2.5 years ago when he had initially thought he was going to. And I shamed him into not abandoning the ship at a crucial time of transition. And the fact that Victor gave us another 2.5 years of service, well past what he needed in terms of service time, he's probably on the diminishing return side of the state service. But his service the last 2.5 years has been invaluable to me, to the work of this agency, and to helping us maintain our excellence in public health. Victor, for those of you who don't know, is an expert in community partnerships, community relations. His leadership was crucial in helping us to achieve vaccine equity through the pandemic. We're one of the few states that achieved that. And because of that, there are many Mississippians alive today because of Victor and his team's work. And then being willing to take on the tasks that you were able to. You and I know what that means. Nobody else probably will, but I am extremely grateful. I cannot thank you enough. I wish every blessing and retirement. And again, let's get the 90 days out of the way, then get you back to work helping us. That we can't let your expertise go to waste. The people of Mississippi need it too desperately. Now, how's that for twisting his arm? Victor, congratulations. Thank you. Everything complete, Robert. Thank you.
Very well done. What questions do we have for Dr. Edney? Any questions? Edward Hill is very happy. We need to let him know about what you're doing. That's on with education, our partnership with the Department of Education. All right, next item. Logan Dillon, can you come and update us on our
Logan is at the Capitol and
where he needs
which
to
is
be?
where he needs to be.
Well, the chairman here.
That's right. That's right. So the only action item we have coming out of the strategic planning would be the issue of trust for public health. So if you think you need a vote to add that to the agenda, or just instruct me to add it to the agenda, I'll defer to you.
I think we can have a vote, don't you think? Can I, y'all know about our proposal, re the Public Health Trust, which is our request that the state help us develop a trust fund to support some of the important projects within the Department of Health, focused on perhaps the cannabis work we do, and getting, if there is some money that comes from that tax standpoint, that percentage of it be directed toward public health. Is there a motion to add that to our legislative agenda?
This Chairman likes.
There's a motion and there's a second. What other discussion?
Just to be clear, what we're really saying is we'd like the medical cannabis revenue to be used for public health purposes. It doesn't necessarily have to be a trust fund or a special fund or anything of that nature.
Correct. I mean, it's correct. We would like,
There's just a long history of healthcare trust funds in the state.
you're correct. And we're adding this as a concept, in a conceptual, but hopefully if there are some revenues that come from that program that we are administrating, that some of it can go back into public health, just what we feel is appropriate. All right, is all in favor, say aye. Any opposed? All right, very good.
And then Sharon, is there?
Right here. So there's really no updates since last night. We went over our legislative appropriation last meeting. Just as a reminder, Dr. Eddy said we do have our House and Senate budget appropriation committee meetings next week. So we'll know more at the April meeting, hopefully. I don't, do you have any questions for me? I'll be glad to answer.
What questions? Any?
Okay.
All right, thank you. Next on the agenda is our consent agenda. There are 3 non-controversial items. Would any of the board members like to extract any of these for further discussion? Items 1, 2, and 3.
Mr. Chairman, I would like to extract consent item number 1.
All right, very good. Is there a motion to approve the consent agenda minus item 1, which is items 2 and 3? There's a motion. Is there a second? All right. All in favor of those 2 items, say aye.
Aye.
Any opposed? All right. Now on before you is item number 1, amendments to regulations concerning Bureau of Emergency Medical Services. You know a few things about emergency services. Can you address this?
Sure. I think most of the amendments in this consent item are good and should be adopted. My only reservation centers around Chapter 10, which deals with flight paramedics and critical care paramedics. We've discussed this, in the, EMS committee. Spent a good bit of time, in fact, an hour talking with the chair, or the executive director of the EMS Compact, which is a network of 24 states, of which Mississippi is one of them. And the way Chapter 10 is written is in violation of their policies that we're obligated to follow. So I've drafted a proposed change, and there was this sense of the committee that it could be sent back, that chapter be sent back to EMS advisory for revision, and then bring it back to us. We can talk about it in as much detail as you want, but that's kind of the bottom line.
I think you've explained it, and I think that's appropriate.
And just to be short and sweet, part of it centers around the way it's written requires any critical care paramedic or flight paramedic practicing in Mississippi to go through a Mississippi training program. And Compact does not allow that. So we're looking, I developed some language in talking with the executive director that we can use, and then I don't think it'll be a significant delay. It just needs to go back.
I think all we need to do is if you don't mind making the motion to approve these amendments, but withdraw chapter 10 for further work.
That's all I'm asking for. So I'll make that motion.
Is there a second?
That-
All right, there's a motion and a second to approve these amendments minus withdraw chapter 10 for further work. All in favor, say aye. Any opposed? All right, we're moving along. Very good. Next is committee reports. Why don't we start with the Maternal Health Committee, Dr. Cheney, who's been doing great work with them.
We met last week and basically discussed two items. There is a committee called Maternal Mortality Review Committee that's not a committee of the Department of Health, but it's supported by the Department of Health, and they they analyze maternal deaths and give recommendations. And we talked about the November 24 report and how we might support some of their recommendations. And then we also discussed the OB system of care concept, and the committee, if I could, I would like to make a motion. It's an appropriate time.
Yes, and this motion comes from the committee, so it will not need a second.
And we recommend that the board approves agency leadership to move forward with overseeing adoption of an OB system of care.
All right. And this would be the adoption of an OB system of care similar to our trauma system
In
of care.
addition to the other three systems.
Is there, since this comes from the committee, it already has a second. What discussion do we have before we vote on this?
I would say we need to specify the trauma system of care has a payment schedule, and hospitals have to pay and so forth. This is more like the STEMI system from the Healthcare Alliance, so it'd be similar, but a little bit different.
Good.
Mr. Chairman,
Yeah.
if I may,
Dr. Eddy?
thank you. To Dr. Waite's point, this will be a system of care, and we will be partnering with the Mississippi Healthcare Alliance as we do with stroke and STEMI. As we have been working, if you remember, y'all authorized me to go ahead and pursue the concept and whether it was feasible. We've been spending a year doing that, and at this point, I want you to know that with the relationship with Healthcare Alliance is there. We have been working with OB leadership around the state. We have been working with hospital leadership and discussing this further with legislative leadership. We don't need legislation to do it, and also with pediatricians and neonatologists. And really, we have a very strong consensus that this is needed. It will move us more towards national standards with perinatal resuscitation. It will facilitate transfers from rural areas up to higher levels of care. And our goal is for high-risk pregnancies or those moms that are stable for transfer be transferred and deliver in a birthing hospital that has the right level of NICU support for the baby and the right level of intensive care support for her. And currently, we do a lot of delivering and transferring, is flipping it to transfer and delivering as much as we can. And the system of care is going to be desperately needed for that. A big part of this also are the designated levels of care for the birthing hospitals and for the nurseries and NICUs, which will also be moving us towards national standards. So just as we have trauma levels and STEMI levels, stroke levels, we will have birthing hospital levels of care that will be designated by survey rather than self-attestation. And likewise for the nurseries and NICUs. So we know which hospitals are able to handle the different levels of prematurity with birth. I can tell you that at the national level, ACOG has been very interested in tracking this work. We've got a lot of national attention about what we're doing with this, and in its most mature phase, I hope that it will be incorporating 911 and that as our paramedics become further trained with the Stork initiative, that we will have a lot more first responders intervening early instead of waiting till these ladies get to the hospital, if they make it to the hospital. So I'm really excited. We have the financial support to do this. We have the political support, mainly the hospital support. We have UMC's full support. So I think now's time to go.
All right.
To reduce both maternal and infant mortality.
What other questions do we have about this item? All right, so on the motion from the Maternal Health Committee, all in favor say aye. Any opposed? All right, that's a big deal.
It's a big
Good
deal.
work.
Thank you.
Good work, Dr. Cheney, too. You're committed. The next item on the agenda is the CON committee report. I'll make that report. We had several meetings, and your committee has 3 recommendations for full board adoption that are in addition to what we've already approved in the past, which dealt with substance abuse, psychiatric care, and perinatal services, which was last year. We want to, the 3 recommendations are: 1, that we remove the capital expenditure limit. Number 2, support elimination of CON for outpatient dialysis for hospitals providing inpatient dialysis. And 3, support CON exemptions for rural hospitals providing 24/7 acute care services. These were extensively discussed with advisors and experts in the field who they were supported by most of the advisors. So these are the 3 recommendations coming from the CON committee, and it would need it doesn't need a second, but I would like discussion about. What do y'all think about those 3? Removing the capital expenditure limit. Well, I can say that I think that there was more comfort and unanimity of approach on the first 2 as it relates to the capital expenditure limit and the dialysis. Dialysis is certainly trying to make it easier for people to travel as far for services and keeping them in the home community. On the last one, I'm a strong advocate of trying to remove any sort of burdens on rural hospitals who are providing 24/7 care. And I think that we ought to certainly do everything in our power to work with policymakers and others to try to figure out a way to make that work, to improve the number of services in rural areas, to create financial benefits to those rural hospitals. I think that that was going to take a little bit longer, is my gut. And I think what we're
what our intent was, because I made that motion to COA committee. I think our intent was to express, well, the first two, we're hoping the legislature really moves on. But I think the last one, we're just hoping to be a part of the discussion and work with the various stakeholders to make sure that we don't mess up along the way.
I think your comment at the time was a conceptual
It's a
idea
conceptual idea.
as a way to help rural facilities and try to find a way to stay open.
And the people who are served by them to get more services in those areas, which, at the end of the day, all this is, we gotta have the facilities and the providers, because without them, you can't provide service, but at the end of the day, it's about the patients. And I think that concept is one that we ought to be very, very much, I think, try to work towards to see if there's a way to go there. I just wanted to, since we had that long discussion in the committee meeting, I just wanted to separate the first two for the benefit of the board and public. We recognize that there's perhaps a little bit more, it's more than dotting of I's and crossing of T's to make that third concept. Yeah,
Yes.
Chairman, I know that there's legislation being submitted that covers what items 1 and 2. And I believe in addition to the three, the topics that we had talked about before, which came out of the third-party report that the legislature funded, we worked with stakeholders to try to examine why there's a demonstrated need statewide for perinatal services, psychiatric residential treatment, and substance abuse disorder. So this is an addition to those are the three that you referenced. Just
Dr. Waits.
It's pertinent to what he was saying. Would you read that statement again, number 3, just for the public as well as Craig?
Support CON exemption for rural hospitals providing 24/7 acute care services. Then I think in concept. All right. What other discussion? Are y'all okay voting? We'll try to vote on all 3 at one time unless y'all would like to divide it. I think all in favor of the CON recommendations, those 3, say aye. Any opposed? All right, very good. Now we're under new business. We're coming along.
Dr. Carlton, did you have a report from EMS? Did you
Nothing to report other than what we talked about under the consent.
And our other committees, the audit committee, do we have anything from the audit committee? Or we'll keep going. New business. What new business do board members have or would like to bring up for discussion? Bless you. If no new business, old business, Dr. Edney, we were going to get an update from the syphilis task force.
Sure, and Dr. Sutton, I just realized I gotta get me another chair. Victor has done an amazing job with leading the syphilis task force, which goes to one of our strategic planning initiatives in terms of making sure that we had program alignment and the effectiveness more robustly. The syphilis task force is a great example of that because, Victor, how many members? The task force, there are 10 or so. The 12 members, which cuts across the breadth of the agency. We were incorporating every program area that was working on syphilis for ad expertise in the area. And I'm been very pleased with the work product thus far. I don't have the 2024 final numbers in. The forecasting looks better. I don't just can't report numbers until I get the final vetted numbers. Who all has seen billboards? If your eyes are open, you're seeing billboards. And I was in a meeting yesterday, Chris and I, in the middle of the meeting, they said, "Are y'all the ones putting up the syphilis billboards?" I said, "Yes, yes, we are." But that's those billboards are part of our raising awareness campaign, which has been extremely effective. And I have got more feedback about the billboards, and they're different billboards in different regions of the state, and they're strategically placed, and a lot of thought was put into that. And it has really helped drive the ability to talk about syphilis at the community level and the investments that we have made at the county health departments and our highest risk counties is paying off. And I'm very, very proud of the partnership that's developing between us and hospital emergency rooms. And I can tell you, Mr. Albert, Greg Gibbs, Dr. Jeremy Rogers, and Laurel have been great to work with. And so South Central Medical Center is beginning universal testing to help us. And, and our goal is to test to treat, not test and send them to the health department, but we are providing the resources. So this is not costing the hospital, extra money. We're payer of last resort for the testing and for the treatment. And we far prefer that they get their treatment in the emergency department if possible, or if we're doing our disease investigative work and we're finding them in the home, that we have a public health nurse with them to treat in the home and try to eliminate that last piece of going to the health department where we lose too many people. And so far, so good. And,
So the numbers are looking like they're going in the right direction.
they do, especially for congenital syphilis. These are provisional forecasting between our numbers and the CDC numbers, but I'm optimistic. 2023, we still had higher numbers, but the rate of rise had slowed, if you remembered. So with the slope of the curve started coming down. And I really think this is a great example of investing in public health and the return that you get. And this is a return in money, but more importantly, it's a return in human capital. We are saving babies through this effort.
Very good. All right. Any questions about the task force? All right. We do need we have a personnel matter that will need executive session. So we'll need to go in executive session. Any other comments before we go into
Go
executive?
into executive session. I think we ought to thank our legislators for taking time to come down here today. I know how much the demand on that time is, and I personally appreciate them taking the time out of their busy schedule to come down today.
We certainly do. And thanks. If y'all like to make any comments, Chairman Creekmore, do you have anything to tell?
I'll walk out the door, so,
Yes.
but thank you for the opportunity to be here, and I look forward to coming back again if y'all have me. And thank the board for the CON support. We do have a House bill coming, and I believe a Senate bill as well, so it mirrors most of what y'all talked about, so thank you.
And thank you for your participation in our work.
Yes, sir. So glad to do it.
Chairman, do you have anything?
Well, I will say this, Senator Blackwell was here, but he left. And on his way out, he gave me his proxy.
Okay. This is a double chairman
So
statement.
we're not permitted to vote. So I get to not vote twice, but we're permitted to talk. So we get to talk twice as much because I've got Kevin's. All I want to say is thank you for the good job you're doing. I come to these meetings because I learn things listening to people who know more than I do, and I'm happy to be here.
Thank you for being. All right. If no further questions, I need a motion to go into executive session to discuss a personnel matter. That's there a second? All right. Was there a second? Got a second? Okay.
We discussed the annual performance evaluation of our state health officer, which was very positive, and we voted to increase his current salary by 5%, which hopefully we'll begin in March. If we can get that.
Thank you very much.
There's one more item before we close. Do note that our next meeting is April 9th. That we need to approve a donation. This would be under old business or new business. Approve a donation from the Susan G. Komen Foundation of $69,000 to be utilized by breast and cervical cancer program. Is there a motion to accept this donation?
So they're donating to us or?
Yes.
Okay.
Yes.
No strings attached, just use it in the program, however you see fit. That's correct.
Yeah, they've got some specifics in the program, but we'll follow that.
All right, there's a motion and a second. All in favor, say aye. Any opposed? With that, let's, a motion to, what should we say? Is there a motion to adjourn?
I'm so.
All right, we're done.
The deed is done.